Welcome to this edition of our kitchen table. Today we're meeting with four of our great leaders as all of us are working in this historic moment with a pandemic that's affected the world, but certainly our members and our affiliates across two great countries. And so today I thought that we would spend a little time to check in with the leadership that has been dealing firsthand with these issues. And I'd like to welcome to the kitchen table Gerard Fitzgerald from Local 94, New York, New York. And Dennis Lawson, president of our Washington State Council out in Washington. Sean Caldor from San Jose, California. And Aaron Mitchler from New Orleans. Brothers, welcome to the kitchen table, and thanks for spending some time with us. I know you've got lots to do and your hands are full, but hopefully maybe today's discussion can help share a little light with our affiliates around the IAFF. I just want to start off with reminding everybody just a couple of things, and I'm so proud of our union and particularly our incredible staff, as well as our executive board, who've really been out in front on this. Quite actually since mid-January, we began our information, began to build our toolkit, recognized that this appeared to be an epidemic at the time that could bring a significant impact to our communities and certainly to our members. I know that we were able to share some of the commitment and some of the challenges, Dennis, that you and particularly our leadership in Kirkland faced. I think that was the first large group of our members exposed in February to the coronavirus. And I know Aaron has, hope you don't mind, Aaron, but personally experienced the impact of this epidemic in a very personal way. So glad that you're able to share your time with us today. I also want to make sure that everyone knows that your union is operating at a very high level. 170 employees operating remote, operating telecommuting, but doing everything that they normally would do, pushing out the programs, the product, the services, the tools, and most particularly the information that our members and our leadership so desperately need. They've really met the challenge, and they're doing extraordinary work on behalf of all of us. And we're also focused and continue to be engaged with all the various agencies, including Congress on Capitol Hill, trying to work on the different stimulus programs to make sure that we get our piece of the pie, quite frankly, but also working with CDC on their protocols and guidelines, HHS, FEMA, Department of Homeland Security, to make sure that we're doing everything we can to respond to your needs. And so with that, I'd like to just ask each of you, and Gerard, if I could start with you to just kind of share your current experiences, kind of what you've been going through as a local and as a local leadership, but also and trying to keep up with the ever-changing protocols within your department and your state. So just why don't you share with our audience the New York experience?
All right, thank you. Hey guys, how are you? The New Orleans fella, I'm glad to see you doing better. I wish you the best to you and your family. What's going on here in New York? Well, I mean, we're all over the media of how many cases we have, how many deaths we have, but how it's affecting me and Local 94. It comes down to in New York, we do not have a separate. Firefighters are not EMTs and paramedics. You know, we're not cross-trained or respond as such. We are CFRs, so we have a lower grade of care that we give to the public when it comes to us responding to EMS runs. The EMS system, they're being overrun. They're inundated with runs. They had 7,000 a few days ago. So what has happened FEMA has sent a couple of hundred ambulances as of such, which some might be from your locals, and they're very much appreciated, but they're helping the EMS system respond to what's going on. Now, what's happened to firefighters, my local, is that they changed our work chart. So we're in a platoon type system, ABCD, where we work at 24, then 72 hours off. And then if you're available for overtime or needed in overtime, you're brought in, but you can't work more than 24 hours. So really, you're only available one of the days that is outside of your regular chart. So at the beginning, they tried to quarantine to try and contain the disease. That didn't work. That was short-lived. I think it lasted 6 days, and then they went to this platoon type system. So the biggest complaints that we have here, and I'm sure it's true across the country, is testing. Our members can only get tested if they're showing signs or symptoms. But what the job is doing, that if you do have symptoms, you're being put on medical leave for 7 days forthwith, and then reevaluated after those 7 days. So they're acting as though you have the disease and going from there. But not getting tested leaves a mental anguish that our members are feeling, and then for the sake of their families, on whether they have this in their homes. We have been able to get testing through Northwell hospitals here in New York or through their urgent care units, but we're not getting priority results. That's a real problem. We're not getting tested without symptoms, which, a lot of our members would like that, so that they're not bringing it into the firehouse. But as we all know, that a false negative is a lot worse than a false positive at this point. So haven't had luck on that. We have been able to get housing for firefighters who have, whether they have a sick wife or pregnant wife, or children that are sickly, or they're living with their parents, where they might fall into that 20%. So we've gotten housing for them in hotels away from their families if needed. So we have more than a handful of guys and gals that might be utilizing that at present. Coming down to it, we're rationing PPE, which is a real problem. The concern about PPE and N95 masks. We're on orders now that we're supposed to wear the surgical masks at all times outside the firehouse, and guys can wear them inside if they're concerned as far as getting exposed inside the house. But we're 3 weeks into this. This is a problem that it's taken this long. Only last week I was able to get the firehouses to be sanitized. Now, some people might say it's a decon, but it's not a full decon. It's sanitizing the firehouse. We've had some firehouses that have had more than 20 members come down with this disease. So what they've done is that for a while they stopped detailing guys. So if you were assigned to a firehouse, that's where you worked and you stayed there. But then this past Saturday, to try and equalize the manpower, because some firehouses have been hit harder than others, where they have started to detail members to fill in the manpower on some of the firehouses where it was very low. So we have our problems, and a lot of this stuff we can't fight the way we normally would by getting court orders or injunctions or trying to stop. And not that we are there to help, and we're trying to get through this the best we can.
Gerard, before I move to one of our other guests, level of cooperation with the department. The department, I guess, cooperating with the local.
As far as cooperation, they've been informative. They've told us as they're moving along. Although a few things have been sprung on us, but they talk like this is a doomsday scenario, and then the next day there's something that's happening. Cooperation, there's not a lot of cooperation on the sense that they have the ability to do whatever it takes to try and keep us in business, which we're fine with that. That's our jobs. We know what we're here for. We know where our jobs are, what we swore to do, and we will come through this, and we will do exactly what's needed. But the biggest problem, like I said, is bringing it home to our wives and families. That concern. We would like a better way or a better system that and testing. The whole country or the world didn't have testing, and now it seems to be getting a little more available. We want our guys tested, and and we want the results We believe that the doctors, nurses, healthcare workers, firefighters, cops, that we should be getting priority results, not waiting. Some guys have waited as many as 10 days to get a result.
Dennis, I know that it hit early out in Washington State, and I mentioned Kirkland. I guess was one of the initial exposure areas for our members. But why don't you bring us up to speed on exactly how you've been dealing with this and where we are now?
All right. Well, thank you. Thanks for the opportunity to be here today. We're about 6 weeks into this, and what we found initially was kind of like what they're describing in New York. It was just we were just flooded with lots of questions looking for the information. I will say, and I've said this pretty openly, is that the IAFF, working with your team back there, provided a lot of guidance initially on, which is very helpful. Where we are now is that we believe, and we obviously are cautiously optimistic, is that we may be either approaching the top of our curve, or even at it, or maybe even coming down the backside, depending on who you're talking to. We have got to a point now where most of our individuals, if they need a test, they've got it built up. We're getting some results in 12 hours now. And to Gerard, my heart's out there, man. I mean, because that's what happened with us from the very beginning, is that we were taking 5 days to get some results back. In some cases, they were telling we'd take longer than that. So the testing part of it has definitely ramped up. The communication with our membership has maintained, kind of where we are as far as at least putting out the information that we want to share. We are seeing, again, a decline in call volume, which is kind of interesting. Our normal call volume is down in most cases 25% across our state. Most everyone has really taken to heart by staying at home, not going out, not doing the things they normally would do, which means they're not on the roads. They're not out in the bars. They're not out doing other activities which may require us to go to work. And right now, we feel pretty good that, with our response capabilities, with our people in Washington, I would say, 99.9% of our group is either EMTs, paramedics, and firefighters. We're consolidated. We all kind of share the same hats. And I think, our protection, our level of PPE and things like that, we initially had concerns. I think you may have just seen our governor of the state of Washington just sent 400 ventilators back to the stockpile, which hopefully will end up in New York, Louisiana, Detroit, Chicago, these places that need them. And I think we're going to be able to send more. And hopefully we don't get into a situation where we have jurisdictions hoarding, which is going to be problematic. We got to start helping each other out.
Well, and as we've been trying to do, and I mentioned an incredible staff, I'm encouraged that our toolkit that was put out early and literally is changed every day, updated, being actually ahead of CDC on some of the protocols, and CDC coming around our way. So hopefully our leadership has been able to, find that toolkit more than just a useful resource. It's our understanding that many state governments and local governments are actually using that for their information resource. So let me, Sean, if I can shift to you from San Jose and give us a sense of what the experience has been, what you're doing now, and how you've been utilizing maybe some of the guidelines that we've been developing.
Thank you very much. So for us, we thought we were ahead of the game. WHO put out the announcements about a virus in China on January 10th and said there's no evidence of human-to-human transfer and no sick healthcare workers. We monitored that. We got the warnings. End of January, we put out revised PPE instructions to all of our members. All the notices were put out. Very early February, updates about transports in response to the hospitals. And that's where we sat throughout February, expecting this to be a traveler-related issue. We didn't realize is in the last week of February, it was very much in our community and very much in our firehouses. Right at the end of February and first couple of days of March, we got notices from public health that our crews had been on COVID positive patients that were not travel related and didn't have on the right PPE, which started to turn into isolation and quarantine issues and testing issues for our members. We also had a member who came to work with a few symptoms, and he worked his shifts, he attended a class, he worked some overtime, and the number of people that were contacted by that person created another issue for us. And we realized it was pretty soon, any one of our calls we go on, any one of our coworkers, any one of our family members. And so we spent the first couple weeks of March really coming to grips with that, putting in place the Department Operations Center, having an incident action plan, having a huge team in place to deal with that, educating members on what they need to do, and so that they understood it's a personal responsibility. You owe it to your coworkers to come in and have testing in the morning. There was some discussion about can temperature tests in the morning be required, and what's our union position on that? Frankly, we had to sit down and say our union position is keeping everyone healthy, keeping everyone safe, and we all owe it to each other. And if someone really wants to push back, we can have that discussion, but this is a minimum steps that can be taken to keep it out of the fire station, because we never know where we're going to get it. Throughout all that process, we've worked with the county to get accelerated testing. We've worked with the city to get an extra 2 weeks leave time without having to burn up your sick time, so people who feel symptoms can feel comfortable going away. They don't need to worry if they have the sick balance to support it. Lots of support for members. We still don't have the housing problem solved if a member needs to isolate but can't go home because they have critical family members at home who may be immunosuppressed. We don't have a solution to that. But we're now in a much better place where at one point, or cumulative, we now had 15 COVID positive members. That's about 2.5% of our department or sworn force. The new infections have dropped significantly. We are seeing family members infected. We're seeing people get it from home and out in the community, catching those early and stopping that from moving around. But we have the PPE in place. We have the policies in place, and really being very, very defensive. We do what everyone here, and I think at least the California departments I've talked to, the one in or scout procedure, where one person dressed in everything goes in, makes contact, asks screening questions, puts a surgical mask on the patient, checks the temperature before anything else is done, as long as the patient condition permits. The challenge now is really the behavioral wellness aspect of all this. There's still concern about what's going on. Many of our members' spouses have been laid off. The economy here in Santa Clara County has been shut down. Buses, light rail, businesses, it's a ghost town in many places. For many of the Silicon Valley workers, they're all working from home. But if you're not fortunate enough to have one of those situations, the job losses are going to have a huge impact. And the next step of that will be the city's budget. And we're working through, the last thing we're working on now is the whole workers' compensation process. Because right now, if you're quarantined, we're fortunate to have paid administrative leave. But if you turn out you're sick, then you go on sick leave until you can prove a workers' compensation case. And that's a challenge for us right now.
Well, I can tell you in the stimulus package, it was just passed, I guess, a week and a half ago. There's about $500+ billion for state and local government, and we certainly are working to make sure that those resources actually hit the ground where they're needed. We've also been able to secure approval that they will be the resources coming through FEMA to our communities. We'll be able to use for callback, for coverage for quarantine, and for overtime. So we're working to make sure as that starts to actually hit the communities, we'll have it laid out that it can be utilized for some of the issues, Sean, that you just pointed out. As we're also working on COVID number 4, this looks like there's going to clearly be a fourth stimulus package, and we're going to continue to work to make sure that those resources can hit the ground out in our communities and our departments where they're needed. Aaron, let me come to you. And as I mentioned, I know that you had a personal experience with this current healthcare crisis, and it's so good to see that you're doing so much better, but also knowing you that you kept doing your work. As we spoke a couple of times over the phone, you never stopped taking care of your members. But I know that New Orleans right now is another hot zone. And so why don't you share with us exactly what your experience there is now, how our members are doing, cooperation with the department and the city. Let's just hear from you now.
The biggest problem that we ran into and still kind of running into is communication and getting the information from the department. They really don't want to release the actual numbers on guys who have tested positive or guys who have been exposed. We've actually had the guys contacting us personally every time they come across an exposure or when they do get tested. So I think at the current numbers we have from our own personal numbers are about 29 confirmed positives and somewhere around 60 guys being monitored who have been exposed to the virus, and we have another 32 that are out on sick leave right now, so including myself. So that's the hard part is the city does, or the fire administration doesn't want to let us get those numbers from them, so we don't know exactly where we are. With that being said, the past few weeks before this all started, we were in a battle with the city on staffing issues, on how low we are on manpower as it is right now. So anybody we lose is detrimental to what we're doing. Because like some other departments, some of the other guys who were talking, we're not an integrated department with EMS. We're separate from EMS. So when we lose guys, we're the only front line, we're the only defense against fires in the city. And if a fire breaks out, we've had a few large fires in the past 2 weeks that the guys are responding to. So if these guys are injured or out of work, it really is a detriment to the citizens and the firefighters in the city. PPE wise, we've been pretty good with PPE. It's been trickling in. We've been getting donations from people. We've also had stuff coming in from the stockpile from Homeland Security, which has been good. EMS instituted that Protocol 36, where they screen the calls, the dispatch screens the calls to see if anyone has flu-like symptoms. The problem with that right now is people are starting to catch on to that and not wanting to say because they're scared nobody will show up. So they're not saying that they have the flu-like symptoms, so we'll show up. The thing about the Protocol 36 is if someone does have those symptoms, they're taking fire out of the loop and not sending us on those calls. We generally respond to every EMS call that comes out. But with that in place, they haven't been sending us on those. But like I said, people are starting to, clam up and not really say that they have these symptoms because they're scared. They're worried that someone isn't going to show up for them. So we're actually showing up and more guys are being exposed. I was able to, talk to the chief and get the houses disinfected professionally. Some of the ones who we have a lot of people who are exposed. We had one house that the entire, all platoons were exposed and tested positive. So we've been working with that to get those places disinfected professionally, not just by our guys wiping it down ourselves. We've also instituted the one guy going in fully dressed to a call when we get there to assess the situation. What else? We have it took a little while. That was one thing I wish we would have got done sooner, was the quarantining. We do now have hotels where guys who are exposed and don't want to go home do have a spot to go to a hotel to do their quarantine if necessary. But we're still looking at possibly having an upsurge. We're one of the hot spots right now, and we're still looking at the upsurge of just getting worse before it gets better.
What's the status on the testing right now, Aaron?
Testing, we were having problems with that. We're still having some problems with that. We have 4 testing sites that are 3 of them are run by FEMA. They're talking about maybe shutting those down or shifting those over to the hospitals. The first few days, the first 2-3 days, it was first responders only, and then it was opened up to the public. The problem with it is you have to have, symptoms. Most of them, you had to have a fever. When I first got it, I didn't have a fever, so that's why I couldn't get tested. It took a while. My doctor actually had to send me to get tested because they weren't going to test me because I didn't have a fever at that time. So that's one of the big problems. If you're not showing all the symptoms, they don't want to use the tests. But we've been getting it to now where if you show you're a first responder, they'll bring you to the front of the line, because for a while you had to wait in line with general public, and they would run out of tests. So testing is getting a little bit better, but it's still I'm still advocating for everybody on the department to get tested. It seems like a no-brainer, but they're still holding back from doing that.
if let me run a question by all four of you, and just kind of your initial answer, and that is, if you're advising our locals right now, what would be your advice for how they should approach their COVID-19, assuming that this is continuing to evolve? Other places will become hotspots and experience it, at ever increasing levels. Just kind of your initial suggestions, recommendations on what our local leadership should be focused on as they address this challenge. Dennis, I'm just going to, on my screen, I'm going to go from left to right. So I'm going to come to you first.
I think it's really the local leadership has to be engaged. And I think that's probably the critical part about, how it's going to be handled right away right now, is that it's going to be a time commitment. Everybody has to understand that this is pretty much, you're going to have to utilize your executive boards, your other members, but our local members need to also understand that depending on where you look, you're going to have a different answer. And they have to be careful not to go answer shopping everywhere. And that's why we've tried to at least stay focused on what our IAFF is putting out, what the CDC is putting out, encourage our members to get off the news and quit trying to self-evaluate and self-diagnose and cure themselves, when in fact we know some of the things and proven ways of protecting ourselves are already out there. We also need to make sure our members understand that we are working and trying to find the answers the best we possibly can, and sometimes they're not found within the first hour of a question. It requires a little bit of work. And I've asked our executive board, represents our entire state, 127 locals, get out there in your communities, talk to your local leaders, make sure they know from the state level that we're working. So that's kind of where I'm at.
Sean?
I'd point to a couple big things. First, the IAFF has a great resource available. There's been a lot of learning going on over these past few weeks, a lot of communication, and compiling that in one place. That's a great first step to go. If you don't have anything going right now, that's a great place to go, and then really a checklist to follow. Do we have return to work rules? Do we have a flow chart for quarantine, isolation? Do we have a department infection control officer, a designated exposure control officer? All those things in place to make sure you're ready to handle the call volume that comes. The other thing we found very useful here in California is we have a network going, probably 100 to 150 people, a weekly conference call. Not everyone calls in every week, but we share what we're hearing, what we're seeing. The whole comments about call volume, we've seen that as well. Overall call volume is down, but as a person who works on an engine and works my shifts, I can tell you half of my calls, if not more, have people with high fevers. The last patient I had was 105.7, and the call was for someone with just mild shortness of breath. So it's going around everywhere. But again, just talking to your other locals, seeing what they're doing. And if you don't have a plan in place right now, you are far behind. Trying to now suddenly say, how do we get a supply of PPE is going to be really, really tough. So even if you're still questioning whether you need to, you do, and now's the time to do it.
Gerard?
I would use the examples of everybody that's gotten hit so far. So I would start rationing PPE. I would limit the amount of people that are going into the room that if you do have a COVID case. As far as the firehouses are concerned, we have a survey right now that you have to answer, a 5-question survey before you can go into work. Do you have a fever? Do you have a new cough? Do you have flu-like symptoms? So if using that before you go into work, and then stress to the members that if you're sick, you're sick. You're not helping anybody by showing up. We're inherently brave guys that are there to help, but you're not helping anybody by showing up if you have any of those symptoms and going into the firehouse, because you could be giving it to the other firefighters in the house, and then them in turn could be bringing it home. So setting that up, limiting exposure, reducing call volume, going on what we call segment ones. If you are a department that is not, that is separate from EMS, reduce everything possible to reduce the amount of exposure, and then limiting contact between one firehouse to the other. If you do detailing, maybe stop that, so that if you lose a firehouse or you get a lot of people in one firehouse that has it, that they haven't spread it to others, that you're not chasing it around your cities. Those are some of the things that we've done here. Some of them have been implemented a little too late, but there are lessons to be learned there for other locals around the country. So I would take everything that people are saying and the best way that you can utilize it, But I would stress to our members that if you're sick, stay away from the firehouse, stay away from your family, quarantine yourself, act like you have it, whether you've gotten tested or not, and get through this process. And then, if you're able to return to work within that 10, 14-day period, so be it. But if you're still symptomatic, stay out, stay away from the rest of the guys and gals.
Aaron.
Yeah, I think our biggest thing is the flow of information. You got to keep that up. Setting up, like we did our guys informing us so we don't have to rely on the department to give us numbers. That's a big thing. And then getting that information out to everyone in the local. I can't say enough about my media director, Doug Shanahan. He's been on top of it. He's been crushing it. And, this really wouldn't work without the way he's getting he gets the toolkits out there every time they come out. He's in, he's constant contact with Doug Stern and getting this information out to the members. And it's been a big thing. That's the huge thing that you got to remember. And like they just said, if you're sick, stay home. It's a hard thing for a firefighter to say, I want to be at work. I want to be doing things. But if you're infecting everyone, it's just, that doesn't help anyone. Another thing I didn't mention earlier is what Chad Major up at the state level he's working on, and we've all been having input into it, is trying to get this COVID-19 carried under the presumptive bill. If you wind up with it, you got it at work. So that's going to be a big thing. He's been in contact with the governor's office on getting that presumption put in there, because that's a big worry to the guys, So that's the big thing, is getting the information out to everyone. And then if anybody has any questions, you go on to the IAFF website and get it, or my phone's always on. You check. We say this at all the meetings that we have is, don't be afraid to pick up the phone. I've answered questions for a lot of locals around the country already, because we are one of the hot spots, and I've been getting a lot of calls on how we handling things and what we wish we would have done better. So my phone's always on. I'm sure everybody else's phone's always on. Don't be afraid to reach out, because this is going to get to your municipality one way or another.
Well, as we're closing off this segment, let me just invite all of our locals out there to please go to our website, take a look at our COVID-19 tracker. We need our members reporting. We have about 500 locals that are onboarded, and we're able now to track on a national in both countries, both bases, on where our members are being exposed, where they're being positive, and where they are symptomatic. And we want to be able to utilize this information in order to try to stay as much in front of this as we possibly can. And to your comment, Aaron, about the presumption laws, I also know our governmental affairs shop is working with all of our state and provincials. I know we just had a presumption passed in Minnesota to cover COVID-19. So we're beginning to make some progress there. We look forward to working with our leadership in each of our states and provinces to advance that. And with that, I'd like so much to thank Gerard Fitzgerald, New York, 94, and Dennis Lawson from Washington State, and Sean Kaldar from San Jose, and Aaron Mitchell from New Orleans. Thank you so much for sharing your thoughts and your experiences. I know it's going to be helpful for our leadership all across the United States and Canada. And with that, everybody, stay safe out there.